or is it
It's
in the
squeeze. Yeah.
I think it's because I have a small hand, so when I
No, you've
squeeze,
got a
like
strong
I
grip.
know, but I get it in the right
Yeah.
because it's small. You know, if it's a big hand, and it's like
Yeah. You get the right
little one
fucking-
does damage. Okay.
Long term though, this hand I got to look after.
Okay. Cut.
Cool.
Habibi Grant.
Habibi.
How are you?
Cool, and you?
Good.
Beautiful day. Happy to be here.
Yeah.
Great. And
Welcome, guys. This is episode 2. Pretty much going to go in depth on blood pressure.
Exactly.
A little bit of details on how to take it, etc. At the end of the podcast. So stick around. We're going to show you guys exactly how to take your blood pressure and all of the parameters and the variables that you should be kind of watching out for. Granty.
Excellent.
You got some info there?
Indeed.
Yeah.
So we want to relate this to you. So we are always monitoring Cole's blood pressure as we go along. That's the most important parameter that we monitor with him. And we're going to do that today. We're also going to actually teach you. We're going to get into a lesson on doing blood pressure. But before we do that, we're going to go into, I've got pulled up a couple of studies. We're going to get into blood pressure. So without further ado, shall we go for it?
Yeah.
Cool. So what is blood pressure actually, and why is it important? So what blood pressure is your cardiovascular system, which is your heart and your blood vessels, works on a pump, pipe, and fluid system. It is a pump, pipe, fluid system. So your heart is the pump, your blood vessels are the pipes, and your blood is the fluid. So what blood pressure essentially is it's the pressure that your blood volume is exerting on the walls of your blood, of your arteries, is what we measure. So it's the pressure that your blood is exerting outwardly into the inside walls of your arteries. All right. And we monitor for the top end. So systolic, what's systolic or systole, the word systole means is when your heart is under contraction. So it's during a contraction, when you actually feel a pulse.
During a pressurization?
It's a good way of putting it.
Yeah.
During a pressurization, exactly. So that's as your heart contracts, sends blood down the arteries. Then that's the systolic pressure, and that's the pressure at systole. So that is the top reading that we look for. That's the high reading. Then a lower reading once the heart's been through systole, it's pumped, then it goes into diastole. So systole and diastole, that's cardiac cycle. So when it's under rest, when your blood vessels, those arteries are under rest, right, after systole, there is a remaining pressure that blood will exert on the inside of the blood vessel, right? But that's the low number. That's what we call the diastolic pressure. Okay. Then, importantly, what we have in medicine, or what we have something called your mean arterial pressure. So actually, it boils down to your mean arterial pressure. And what is mean arterial pressure? So just to give you a definition quickly on mean arterial pressure, what mean arterial pressure is the average arterial pressure throughout one cardiac cycle, systole and diastole. So
what's one cardiac cycle?
So the cardiac cycle is basically systole and diastole. It's the cycle that your heart takes. Basically one pump, and it includes the intrinsic conduction system. So it's depolarization of electricity and repolarization, because that's how your heart gets itself to pump. Yeah. It's got its own intrinsic conduction cycle. So that is the cardiac cycle. Okay. We can actually go a bit more in depth into the cardiac cycle. The Martini textbook that I use got a really good explanation of it, but we can also get it online. The cardiac. So that is, in essence, a cardiac cycle is one pump.
I'm just asking for the viewers, adding
some info there. Exactly. And the cardiac cycle is anyone that's studied medicine or nursing or a paramedic, we all studied it. I studied the cardiac cycle in depth as a student. I don't have it really off the top of my head now. When you start practicing the practical stuff, is stuff you remember the whole time, you know, and the stuff that you
gets pushed to the top. And,
and the stuff that you're not
learning is the foundation at the bottom.
You forget a lot. That's why they say that students are pretty like a lot more clued up than actual practitioners, just because they're in the theory so much. But anyway, so that's it. So
it's fresh in the mind.
Exactly. So who do we look for guidance for as practitioners and as people that want to know what's going on? And in this country, what we do is we follow the American Heart Association. So the American Heart Association is a governing body. It's a non-profit organization. Well, they are an organization that basically spearheads and leads cardiovascular studies And there is an equivalent in Europe. There's the European, I think it's the Resuscitation Council. They've got the equivalent of the American Heart Association. We in this country have something called the Resuscitation Council of South Africa, but that's something else. But where we really look for the latest science and updates of what's going on is the American Heart Association. So why are we testing? Why are we looking at blood pressure? Well, they do call it the silent killing, or the silent killer. So understanding your blood pressure reading. So what do your blood pressure numbers actually mean? Well, the only way to know if you have high blood pressure, also known as hypertension, is to have your blood pressure tested. So understanding the results is key to controlling high blood pressure. So the American Heart Association in 2021 put out guidelines for healthy and unhealthy blood pressure ranges. And they say normal blood pressure category. So they say the normal category is a systolic or top number that's less than 120, and or a diastolic or lower number that is less than 80. They say that elevated is 120 to 129 systolic and a diastolic of less than 80. High blood pressure, which they class as hypertension stage 1, this is where you actually now need to treat it, is a systolic of 130 to 139 or a diastolic of 80 to 89. So it's either or. High blood pressure or hypertension stage 2 is 140 or higher systolic or 90 or higher diastolic. And an immediate hypertensive crisis, i.e. consult your doctor or call an ambulance immediately, is any systolic higher than 180 and or a diastolic higher than 120. That is known as a hypertensive crisis.
And when was that? Did they tell you when it was published?
2021.
Okay.
So
did you say that already?
Yes.
Oh, my bad.
No worries. That's the latest one. So what are the effects of what are we actually worried about? What are the effects of high blood pressure, right? So let's talk about that quickly. What does sustained high blood pressure actually do? So high blood pressure dangers, the effects on your body. So there's a lot of dangerous effects. So the first system to get affected is your arteries. So damage to the arteries. So you get damaged and narrowed arteries. So high blood pressure can damage the cells of arteries in a lining. And then when fats from the diet enter the bloodstream, they collect in the damaged arteries. Eventually, the artery wall becomes less elastic and limits blood flow throughout the body, right? The very second thing that a big negative effect from damage to arteries that you get is an aneurysm. So basically what an aneurysm is, an artery that ruptures, right? So you can imagine that sustained increased high blood pressure can cause that artery to rupture. You can get an aneurysm in your head. You can also get an aneurysm in your descending aorta. So they call it a triple A, or when it ruptures. So you can have an aneurysm in a blood vessel, and that's basically where blood vessels now sheared and bleeds out, and it's fatal.
A ruptured, yeah.
So you can imagine if it happens in your head or it happens in your thorax, it really is a life-threatening problem. So then damage to the heart is also an effect of sustained increased blood pressure long term. So you get coronary artery disease. Coronary is a word for heart. So arteries narrowed and damaged by high blood pressure can have trouble supplying blood to the heart. Another thing that you can get is you can get an enlarged left-hand side of your heart. So high blood pressure forces the heart to work harder to pump blood to the rest of the body, and it causes the lower left heart chamber, or the left ventricle, to thicken. A thickened left ventricle increases the risk of heart attack, heart failure, and sudden cardiac death. And then actual heart failure is another effect. So over time, the strain on the heart caused by high blood pressure can cause the heart muscle to weaken and work less effectively. Eventually, the overwhelmed heart begins to fail. To diagnose heart failure, you need usually a cardiologist or somebody else does a echo of your heart. They look at it, and they also they do blood tests, and they look for a specific something called a brain natriuretic peptide and atrial natriuretic peptide, which is basically hormones that your heart releases when it's under too much strain.
Okay. Is there like a... So let's say you have high blood pressure, sustained high blood pressure.
Yeah.
So that's 130 systolic.
Yeah, let's say you're 130 systolic, yeah.
Is there I'm sure it's very dependent on individuals' genes, but is there like a general amount of time that someone might start to see serious problems?
That's a very good question.
You know what I mean? If someone's got high blood pressure from the age of 20,
yeah,
is it not doing as much damage because they're young?
No, the more
Is
time
there
that you
maybe
have
a
it, the more the damage is.
yeah, yeah,
The more time that you have it, the more the damage is. And that's why they call it the silent killer, because you don't even know
yeah,
what's going on. But over time, 20 years or 10 years or
yeah?
whatever,
That's what I
then
mean.
all of a sudden
Is there
something
like an age
happens
category where you see it a lot happening a lot more, like age of
as you
40,
get
age of
older.
30?
Yeah. So generally, as you get older, definitely above the age of 35 for males and
Yeah,
females,
yeah.
it's a
So you
really big
basically want to
consideration.
check as soon as possible.
Yes, and
As
for
soon as
any
you,
age group,
yeah,
yeah, for any age group, you definitely want to
mm,
check as soon as possible.
yeah,
Yeah.
yeah, yeah.
So you can have damage to the brain, so you can have a stroke or what's known as, and also something it's called a transient ischemic attack, which is basically a stroke that rectifies itself. You can get dementia. You can have cognitive impairment. Also, what it mentions is damage to the kidneys, so you get kidney scarring, you get kidney failure as well from sustained increased high blood pressure. Damage to the eyes, so damage to blood vessels in the retina, fluid buildup around the retina, nerve damage. Importantly here for males, and this is something that I wanted to get into, is sexual dysfunction. So for you to get an erection, you have to have blood flow to your penis, right?
Mm.
So what happens if you have sustained increased blood pressure? There's so much vasoconstriction that not you can't really get blood flow to the
There's no
penis.
available blood.
Medications to treat erectile dysfunction are a class of drugs known as phosphodiesterase inhibitors, like sildenafil or Cialis and tadalafil, these kind of things, right? So what it'll do is it inhibits, or it blocks some what did I say that thing was called? Phosphodiesterase, and phosphodiesterase is involved in blood pressure, right?
Mm.
So inhibiting the coenzyme phosphodiesterase stops basically that coenzyme from working, and it doesn't allow your blood pressure to get increased,
Mm.
right? So it actually keeps it down. And in keeping it down, what it does is it allows then blood flow into your penis.
Mm.
So like I told you, that influencer that I was watching, and it was actually was talking about that.
Yeah, yeah.
And he was saying that he thinks he lost his erection due to low blood sugar, but it wasn't.
Yeah, yeah.
It was, in my opinion,
This
it was a
blood
blood
pressure.
pressure.
Yeah,
Yeah, I
yeah,
could immediately see it. I was like,
yeah,
but he wouldn't know unless he was treating it.
yeah.
But it is known that it's, and since we males here and talking
Mm.
mostly about
And
male health, we might as well
common
get into it.
amongst. I've actually seen a couple guys, especially when guys are going into prep phases,
Yeah.
and you know, coming into a show or something, and
Yeah,
diet's crazy. There's just
can't get erection.
dehydration, etc. A lot of
Yeah.
guys, yeah. But it's
Yeah.
kind of it's normal because
It-
you're going
yeah.
so extreme at that point. You
It is a
laser
danger sign,
focused
eh?
on winning
Yeah.
that show. So
And you know
do
what I?
whatever it takes, you know. So,
Yes, I didn't mean to interject. That's really
a lot of guys,
yeah.
yeah. You're so kind of dehydrated, not enough carbs, all the rest. I'm sure blood pressure is doing all kinds of things.
Yeah.
And I mean, not a lot of guys show it. So, hey, when I get into prep phase, guys, you're going to be able to see all the vitals along the way.
Yeah.
Interesting.
Yeah, that is very interesting.
Yeah.
And another thing is, if you are having,
hopefully, I carry on working.
people are so afraid of, if you're having sexual dysfunction, this could be a sign that there is something really going wrong.
Yeah. Yeah.
And people don't talk about it enough. It's almost like a bit stigmatized. People think that the medications that are used in treating erectile dysfunction are drugs that make you horny. It's not.
Yeah. Yeah.
It's drugs that lower your blood pressure, that keep your blood
Yeah.
pressure low, that stop it from going high.
People
That
also a
allows
bit
you to have an
embarrassed
erection.
to even.
Yes, men are embarrassed about it.
Yeah.
There's no point in being embarrassed. If you have any kind of dysfunction, especially sexual dysfunction, is pointing to something that's really going wrong. So you must be very aware of that.
Yeah.
And so if you're battling to get erection, take a look
Up
at
as
your
well.
blood pressure and
Yeah.
speak up. Yeah. So then you have, so that's sustained increased blood pressure, but then you have something called high blood pressure emergency, which is basically hypertensive crisis. That's where you immediately, your blood pressure is so high, you're in a crisis, you're going to die due to, or you could die now due to that acute.
You need to go to an emergency room.
Exactly, an emergency room, and then you'll receive medication and so on. And symptoms of sudden or hypertensive crisis is can a lot of the time be classic cardiovascular symptoms like chest pain. What else? There's headache, dizziness, palpitations, that kind of thing. And but especially headache, dizziness, palpitations, any kind of visual disturbances, and that, or just feeling generally unwell.
Mm.
And a lot of practitioners forget this. that they have to do basics first.
Mm.
We work as paramedics when I arrive at a patient, we go through everything. I do something called POMVIT, pulse ox, O2, monitor, vitals, IV, and then D's for drugs that we give.
Mm.
So you're always putting a monitor on, you're always checking vital signs, and because you always have to know. That's what, and I've seen it go wrong before, where I've taken patients from other practitioners where they haven't done basics, they haven't checked the blood pressure.
Yeah.
I've had it before, and I land up with a profoundly hypertensive patient in a hypertensive crisis.
Yeah.
That the practitioner didn't do basics, they didn't check the blood pressure. Yeah. So the
Maybe
first time
gave them other meds and stuff.
they were actually treating them for something else.
Yeah,
And
yeah.
but this patient's biggest problem was that they were in a hypertensive crisis.
Yeah, yeah.
So it's very important. So having said that, how do we actually check blood pressure now? So we check blood pressure. We can do it either electronically. There's a variety of machines that are available. If you've ever seen paramedics or in a pre-hospital environment or inside hospital, where we have heart monitors, proper machine with a good computer inside it that can take a really accurate blood pressure, right? But you have the small machines that you can buy at Clicks, you can buy at Diskim or somewhere else. They are not bad. The only difference is that the computing power is different, where you have like one of the big manufacturers put together a system for paramedics to use that it has to be accurate. I'm making life or death decisions. But the smaller units that you buy from Clicks or wherever, the chip's not the same. You're never ever going to get the same computing power. And we've actually tested and we've seen that there's a difference. So for Cole's blood pressure, I do manual blood pressures because I don't have a big R500,000 expensive machine yet to do it. The next best thing is a really good quality stethoscope, which I have, and knowledge on how to do it, and then experience.
You can use it to at least follow patterns. If
that's
all you have
use
access
it.
To,
yes, if it's all you have access to, use it. If it's all that you have access to, use it. I don't want to knock it completely, but we want to be as accurate as possible.
It's better than nothing.
It is better than nothing, but for your at least so machines or medical equipment needs to be calibrated and serviced as well, and that's in essence the problem with these small machines is the average home user doesn't get it calibrated. So best thing would probably be, they're so cheap, buy a new one every year. If you want to, I wouldn't use one for longer than a year. At that stage you would need calibration.
For sure.
So that's the problem. So when we check blood pressure, there's something interesting called Korotkoff sound. So blood pressure measurement. So I've got a study here. It comes from, this is actually journals and books from Science Direct, Elsevier. Elsevier is one of, and this
Ron,
is.
Should we take? Are we going to take them through it?
Yeah.
Should we take it through with the info?
Yeah, sure. Let me chat now about it quickly.
First, and
then we'll show them.
Show them the practicalities of it.
Exactly. So just to chat about blood pressure measurement. So there are techniques for measuring blood pressure, so measuring and diagnosing hypertension. So there are two primary methods for measuring blood pressure. The auscultatory, so to auscultate in medicine means to listen. So that's the auscultatory method.
It's quite a
and then there's something called the oscillometric method. So we're going to focus on the auscultatory method. So what it involves listening for something called Korotkoff sound. So you listen for the first Korotkoff sound, which is the systolic blood pressure, and then the final Korotkoff sound, which is your diastolic blood pressure. So there's actually a pitch change twice at the bottom, and I listen for the second one. That's the final Korotkoff sound. Okay. So the standard protocol for measuring blood pressure is to avoid consuming caffeine, exercising, or smoking 30 minutes before measuring blood pressure. In addition, blood pressure should be measured while the individual is in a seated position for 5 minutes with his or her or their arms supported at heart level. So this comes from the National Heart, Lung, and Blood Institute of the United States, 2004. And it is recommended that clinicians obtain a minimum of 2 measurements during each blood pressure determination and then average the 2 measurements to measure blood pressure accurately. Then you have ambulatory blood pressure monitoring, can provide measures of blood pressure across entire days or longer periods of time and is indicated in several clinical situations. And it says your blood pressure waxes and wanes according to a circadian rhythm, with low blood pressure values occurring during rest and sleep and higher blood pressure values during wakeful activity. So The second, I just want to get into something here. There was, okay, understanding blood pressure readings. What do they mean? Elevated, your blood pressure is what they mean. I just wanted to get into, okay, there's something interesting that we found called the Apple Heart and Movement Study. If you're interested, I think we'll share that in the link. If you're an Apple user and you want to get involved in a study, the American Heart Association has gone into partnership with Apple, and they've bringing us the Apple Heart and Movement Study, the American Heart Association Apple. You can check it out. It's really interesting. We might even want to do an episode on it itself, and especially when we get hold of Apple and start getting devices and things. That'd be great. Guys, future episode, I want to get hold of an Apple smartwatch that does an ECG function. We want to test that out for you. So look out for that, and hope that Apple sends us a watch. Okay. New blood pressure guidelines. I just want to get into one more thing here behind the numbers, more than blood pressure. Check your blood pressure at home. Here is what I wanted to get into, right? So choosing and using. So the new guidelines note that blood pressure should be measured on a regular basis and encourage people to use home blood pressure monitors. This is the AHA. Monitors can range from $40 to $100 on average, but your insurance may cover part or all of the cost. Measuring your blood pressure a few times a week and see your doctor if you notice any significant changes. Here are some tips on how to choose and use a monitor. Choosing. Select a monitor that goes around your upper arm. Wrist and finger monitors are not as precise. Select an automated monitor which has a cuff that inflates itself, or get somebody to check you like I'm checking Cole. But anyway, look for a digital readout that is large and bright enough to see clearly. Consider a monitor that also plugs into your smartphone and transfer readings to an app, which then creates a graph of your progress. Some devices can send readings wirelessly to your phone. So the higher quality you go, the more accurate things are going to get. Using. Avoid caffeinated or alcoholic beverages 30 minutes beforehand. Sit quietly for 5 minutes with your back supported and your legs uncrossed.
You went over that, huh?
Okay, that's different.
Is it different?
Yeah, but support your arms so your elbows at or near heart level. Wrap the cuff over bare skin. Don't talk during the measurement. Leave the deflated cuff in place. Wait a minute, then take a second reading. If the readings are close, average them. If not, repeat again and then average the 3 readings. So it wants us to average the readings. Keep a record of your blood pressure readings, including the time of day. Without further ado, let's get into checking Cole's blood pressure, and I'm going to guide you through. I'm going to actually talk us through taking a blood pressure. So if you want to buy yourself a stethoscope and a blood pressure cuff, you can also learn to do this pretty easily. And we can check each other. Also, any practitioners out there need a quickly refresher.
I'll put a timestamp in the clip so guys can skip to it.
Yeah, you can skip to. We'll put timestamps in the clip so you can skip to if you want to do that. Cool. Without further ado,
let's take some readings.
Let's take some readings. Welcome to the second segment. We're going to be taking a blood pressure. We're going to be actually running through the steps of taking a manual blood pressure. So, just to remember, what you should do is first of all avoid caffeinated or alcoholic beverages 30 minutes before, and as we've been through, sit quietly for 5 minutes with your back supported and your legs uncrossed. Support your arms so that your elbow is near at heart level. Okay, we're going to take, what you're going to need is you're going to need a sphygmomanometer or sphig, it's a blood pressure cuff is what, but it's the technical term is sphygmomanometer. So these should be calibrated as well. It's a problem with them. So it should start at 0. If this needle is sitting at 10 or below 0 or something like that, it's not calibrated, it's not starting at 0, you're not getting an accurate result. I'd give it about a year, a cuff like this, until it needs to be calibrated. They are quite cheap, so if you see that it's out of calibration, then just get a new one. So you're going to need that sphygmomanometer. It's got to be sized. You get adult, child, and small little infant cuffs. This is a standard adult size cuff. You also get extra large adult cuffs, or you get what's known as a thigh cuff, which is really big, that you can put over a person's thigh. That sometimes very big people, you're going to have to use a thigh cuff on the arm, but Cole takes a standard adult sphig. You're also going to need a stethoscope, and what we're going to be doing is we're going to be listening for those Korotkoff sounds using our stethoscope. The procedure is, the best practice for this is to first get a palpated or systolic blood pressure, and then listen for Korotkoff sounds. The reason you do that is so that you don't have to pump all the way up to 200 or beyond to just search for the systolic blood pressure. You already know because you've done a palpated blood pressure. So I'm going to wrap the cuff around his arm. I'm going to feel for his radial pulse. Once I've felt his radial pulse, which is by the radius, so it's on the thumb side, on the inside of your thumb, I'm going to feel for his radial pulse with the cuff in. I'm going to inflate the cuff until the pulse goes away. Where the pulse goes away, where the pumping up of the cuff has now cut the circulation to that artery off, we know that that is the systolic blood pressure. So say it's at 140, when I listen for the Korotkoff sounds, I only have to pump up to 140. I don't have to go way beyond that. When you pump up unnecessarily way beyond the systolic, you're actually hurting your patient, and it's not, or your friend, and it's not good practice. So that's what we're going to do. Then once I've got a palpated blood pressure systolic, what I'm going to do is I'm going to listen for my Korotkoff sounds. So what I'm going to do is I'm going to pump the cuff up with my stethoscope on his arm. I'm going to pump it all the way up to where I knew his systolic was, a little bit past that. I'm going to hear nothing. I'm going to slowly start releasing air out of the sphig. You'll hear it come out. And I'm going to listen to where I hear my first Korotkoff sound, where I hear blood swishing through the artery. That first Korotkoff sound is the systolic blood pressure. Then I'm going to carry on deflating the cuff while watching the needle. There will be two pitch changes. The first pitch change, or the sound where I hear it get a little bit dimmer, is your second Korotkoff sound, or the last Korotkoff sound. There's a little pitch change a little bit after that, and that's the last Korotkoff sound. So that's what you want to hear for that last pitch change. So you're hearing for when you hear blood swish through the artery, that's your systolic blood pressure. You'll hear poof, 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 poof. You'll hear a pitch change, poof, first pitch change, poof. The second pitch change where it gets even lower, that's your diastolic that you get. Then we're going to let him sit for a minute, and we're going to take another one, and then we're going to get the average, and that's the latest recommendations for getting blood pressure. Without further ado, let's go ahead and check his blood pressure. Make sure that the cuff fits properly. You'll see there's two markings here for the artery, right arm and left arm. I'm using his left arm. This is known as the antecubital fossa, here, ACF. We're going to be feeling for a pulse here at some stage, and the pulse is on the inside of the arm, more medial or more towards the midline. So the marker for the left arm would be here. If I was using the right arm, the marker would be here. So I'm going to attach the cuff properly now. We want to be as accurate as possible, so I've made sure it's a proper snug fit. It's not too tight. It fits just right with a correct artery marker for the artery for the left arm. Now what I'm going to do is I'm going to get a palpated systolic blood pressure. I can feel his radial pulse. I'm going to pump the blood pressure cuff up until his pulse disappears. That I know is my palpated systolic blood pressure. Palpated systolic blood pressure was 130. So now when I listen for my Korotkoff sounds, I know I don't need to go past, I need to go a little bit past 130 and then back, not up to 200. So this is best practice. Now I'm going to go ahead and listen for my Korotkoff sounds. First thing you can do is to actually feel for where the artery is. So feel the pulse. That's where the butt of your stethoscope is going to go. And I can feel his pulse. And I got a reading of 130 over 80. What we'll do now is we'll let him sit for a minute. I'm going to count a minute. I'm going to get another blood pressure. I'm going to let him sit just with his cuff fully deflated. Now I'm going to get another blood pressure, and we're going to get the average. Okay, and we're ready to go. also using the auscultatory method to listen for Korotkoff sound. My first reading was 130 over 80. My second reading was now about 120 over 80. So we're going to take an average between that, and we're going to see say it's 125 over 80. That's what your blood pressure is right now.
Cool. Okay, so afternoon, guys, or morning, guys, wherever you are. I'm just editing the episode 2 here, the blood pressure episode, and just something to add to the end of the episode. Stay tuned, because the next episode we're going to be going to the Sports Science Institution. I've taken my bloods, and they're going to be doing pretty much a full interpretation, as well as some other things. So episode 3, stay tuned, because it's going to be some interesting stuff. We're going to bring it all to you, just go through it, get Grant's opinion.
Going to be UCT Sports Science Center.
Yeah.
UCT Sports Science Center.
Yeah.
Next week, the 15th.
Exciting. So stay tuned, guys. Lekker.